A 45-year-old male with COPD presents to the hospital with an exacerbation of his lung condition. He is in respiratory distress and the physician recommends he sit leaning forward. What is the purpose of sitting like this? A. To prevent falling. B. To help inhale air. C. To prevent loss of consciousness. D. To easily cough out secretions. E. To help exhale air. The answer is E. To help exhale air. COPD is a chronic lung condition marked by air trapping. Patients with COPD are instructed to sit in the tripod position to help them exhale air. Patients sit and lean forward to help maximize air exiting from the lungs. Which of the following best describes the mechanism of albuterol inhalers during an asthma exacerbation? A. Alpha-adrenergic antagonist. B. Beta-adrenergic antagonist. C. Beta-adrenergic agonist. D. Alpha-adrenergic agonist. E. None of these. The answer is C. Beta-adrenergic agonist. Albuterol is a beta-adrenergic agonist. It helps to open up the airways during an asthma exacerbation by activating the beta-adrenergic receptors, part of the sympathetic nervous system. Side effects include increased heart rate. What is the inspiratory reserve volume? A. The amount of air that can be exhaled after normal inhalation. B. The amount of air that can be inhaled after normal inhalation. C. The amount of air available in the lungs after exhalation. D. The normal amount of air that is inhaled with each breath. E. The total amount of air the lung can contain. The answer is B. The amount of air that can be inhaled after normal inhalation. The inspiratory reserve volume for the average adult is roughly 3,100 milliliters. It is tested using pulmonary function tests. The inspiratory reserve volume is the amount of air able to be inhaled after a regular inhalation. This is in contrast to the expiratory reserve volume, which is the amount of air that can be exhaled after a regular exhalation. Which of the following side effects would you most likely expect when providing an asthmatic patient with continuous nebulizer therapy? A. Bradycardia. B. Hypothermia. C. Tachycardia. D. Pinpoint pupils. E. Hypothermia. The answer is C. Tachycardia. Asthma is treated with albuterol. This drug is a beta-2 agonist, which works to relax smooth muscle in the lungs, and open up the airways. A consequence of this drug is the beta-2 effects on the heart. Beta-2 on the heart causes an increase in heart rate, tachycardia, and is a common side effect seen in the treatment of asthmatics. You are a pulmonology nurse taking care of a patient who complains of episodic wheezing. You perform a diagnostic test in which you perform pulmonary function tests on the patient before, and after administering albuterol, a beta-2 adrenergic agonist. You note that the patient's symptoms and FEV1 readings improve drastically with bronchodilator administration. Based upon these findings, the patient most likely has which of the following? A. Lung cancer. B. Chronic obstructive pulmonary disease. C. Sarcoidosis. D. Asthma. E. Throat cancer. The answer is D. Asthma. Asthma is an inflammatory airway condition that is characteristically improved symptomatically and quantitatively, in terms of pulmonary function tests, including FEV1 readings, with bronchodilator administration, for example albuterol, the beta-2 adrenergic agonist administered in this patient. In this patient who presented for evaluation of wheezing, a characteristic symptom of asthma, his substantial response to bronchodilator administration makes the likelihood of an asthma diagnosis very high. Chronic obstructive pulmonary disease, COPD, is an obstructive physiology of the airways often due to chronic tobacco smoking. While bronchodilators may be of some clinical value in these patients, their FEV1 readings characteristically do not correct after bronchodilator administration, as this is a major method in which COPD can be distinguished from asthma and other inflammatory airway conditions. Sarcoidosis, lung cancer, and throat cancer symptoms would not necessarily improve with bronchodilator administration, nor would pulmonary function test readings in patients with these conditions.